Dr. Todd Ellerin, Chief of Infectious Diseases at South Shore Health. Doctor, as always, we appreciate your time and your wisdom. Governor Baker says the state will still require all residents to wear masks indoors, but tomorrow they can take them off outdoors as long as they can maintain 6 feet of separation. Do you agree that people should feel safe with this change?
I really do, Maria. I mean, we know that this virus does not transmit well outdoors. So if you think about these three things, outdoors, distancing, and masking, if you have 2 out of the 3, you really shouldn't need a mask. And I think that's what Governor Baker and his team have basically said. If you're outdoors, you can distance, then you really don't have to wear a mask.
So, Dr. Ellerin, let me add something else to the equation. Vaccinated. What's the real risk to people who are fully vaccinated? Is there a reason why they even have to wear the mask at all?
Right. It's a good point, Ed. So some people are asking the question, if we're fully vaccinated, why do we even have to wear masks indoors? So yes, you can get infected after vaccination, but there are very few of those. I think the answer is we still have 40, 50,000 cases a day in the United States. We really want to ramp those cases down. We've never gotten to the point where we have less than 10,000 cases in the U.S. I think once we get there and once we see how we're doing against these variants, ultimately we'll be able to relax even some of the indoor masking as well. But for now, full court press on this virus.
All right, so as you know, Massachusetts ranks very high among states with the highest percentage of residents who are fully vaccinated. Other states with lower numbers, they've already dropped their mask mandates and capacity limits. So why do you think public health officials here are being so cautious, and do you think that it's one step too far?
Maria, Massachusetts is kicking butt with these vaccines, and I think we just have to keep on doing this. It's easy to look back and say we're being too conservative, but let's face it, we still have people dying each day of COVID-19 in this Commonwealth. I just came down from the intensive care unit. We don't have many patients with COVID there, but we still have some critically ill patients. So I think it's really important that we want to ramp down cases as much as possible. We want to get to the point, we've never gotten to the point where New Zealand has, or Australia, or Taiwan, Singapore, places that have really gotten to such few cases. We want to do this. Remember, this is an unpredictable virus.
So I want to go to the other extreme. You talked about the countries where it's been knocked down considerably. But the last time you were on the air, we were talking about the dire situation developing in India, with the number of COVID patients spiking, no room in hospitals to treat them. Is that the worst case scenario that everyone feared here in the United States? And do you think that we are finally out of danger?
India is definitely a worst case scenario, and we have to help them, because if they continue to have these COVID fires, they're just going to generate variants, and one of those variants may be one that really can evade our vaccines, and we don't want that to happen. So wherever in the world there's terrible COVID, we have to try to help those countries. But with that said, I do believe that there's the silver lining, and I think we're seeing the light. It's not even at the end of the tunnel. I think we're seeing what's happening when the vaccines are working. They're so powerful, and they're really fighting against the variants, because the variants are more contagious. So in the U.S., really, we should be seeing cases going up, and it's proving that these vaccines are working. But we're still not out of the woods, and we want to still keep entire pressure on this virus.
Outstanding. Dr.
Todd
Ellerin,
Ellerin, thank you, doctor. Be well.